Hi, I'm Dr. Urvashi Sharma. I've been with the BEAR team since its inception, so it's been almost since 2017, so it's been 4 years now. I'm a medical officer. I've been attached to the emergency department for the last 7.5, almost 8 years now. Yes, in fact, a lot of equipment has caused problems over the years, but one particular equipment that I'd like to mention is the lack of a ventilator. So especially with high priority patients, we just have 2 members attending to these patients. So when we get to the scene, if the clinical course requires the patient to be intubated, needs to have an advanced airway in. So what we generally do is we have a dedicated BEAR member manually resuscitating this patient. So that means 2 of the hands out of 4 are completely dedicated to ambuing this patient. So if we ever have a ventilator, it will mean that 2 of these hands would be free. Currently it's quite taxing on us because while ventilating, we need to medicate this patient as well and think about all the other clinical course of this patient, and we have to act accordingly. That's why I feel like that stress, that burden on us will be removed as well if we have a ventilator. And if I may narrate a particular incident to you, recently me and my partner brother Lode, we were dispatched to Trongsa. So we had to take care of this patient who was in respiratory failure. So when we got there, we had to intubate this patient. So yes, the laryngoscope worked and we were able to pass the tube in, but as we were trying to manually ventilate this patient, Lode's hand slipped, the ambu bag fell and it broke. So, so that meant that we didn't have an ambu bag on us, but luckily for us, we were supported by the staff at Trongsa. So we were able to borrow their ambu bag, and this patient was ventilated manually throughout the flight and only was connected to a ventilator when we got here. So these kind of mishaps would definitely be reduced in the future if we have a ventilator. So one of the airlifts that really affected me personally was when I had to respond to the Laya tragedy. So this was in June of this year, where the country experienced one of the greatest tragedy in its history, and it was a landslide, and this was me and Sister Pemadichan responding to the mission, and there were multiple casualties. So this was the first time we were actually supposed to respond to so many casualties at once, and there were a lot of things that needed to be addressed at that point. So the most important was triaging these patients, and when we were triaging these patients, we needed to find out who was the one of the highest acuity so that they could be transferred to JDWNRH first to institute specialized treatment for them. So this was quite challenging for us. The other thing that was challenging here was the helicopter could not really land at the site of the landslide because obviously it was dangerous, and also because of the weight limitation at high altitude. So we actually had to land at a lower altitude, and we had to hike up quite a distance. We had to hike up, and this was an early morning flight. We don't have specialized gear to hike up to the mountains, so I was wearing my sneakers and we were hiking up quite a bit, and because it was landslide and there was rain, before I even got to my first patient, I was soaked to the skin. My legs were freezing, my feet were freezing, and it was quite difficult hiking up to the patient. So that was one challenge that we experienced. Overall, I feel like it affected me personally, mainly because of the patients, the number of patients that we had to treat. It was quite overwhelming, and also because it was such a tragedy that nobody had experienced in the past, and dealing with patients one-on-one and listening to their stories, it was quite affecting. So all these airlifts affect us. Some of them, they are detrimental, some of them give us a lot of happiness, and although we talk about our losses quite a bit, there's nothing that can really take away the happiness from us. So that happiness bit is a really big chunk of why we do this job. If you follow us on our BEAR page, you'll probably be able to see the story that we posted some time ago. It was about this kid who was airlifted following a head injury, and then he needed to be intubated. So when we got there, he was unresponsive. He wasn't talking, he was very agitated, he couldn't recognize his parents. Obviously, he didn't know what was happening to him around. So we had to sedate him, we had to intubate him, and then we weren't even able to bring him till Thimphu. We had to ground at Wangdi because of bad weather, and from there we brought the patient by road to Thimphu. So the whole time this kid is there fighting for his life, and the whole time we are like injecting medication to keep him sedated, and we are manually ventilating him throughout the journey. We didn't know what was going to happen here. So when we got him here, we got a CT scan done. We showed that he had a bleed in his brain, and even then we were like, oh no, what's going to happen to this boy? A week later, this patient has been in the ICU. This patient was then transferred to the ENT ward and then to the pediatric ward, and finally he is awake. He's talking to us and he's telling us, obviously he doesn't remember anything, but his father's like, oh, these are the doctors who've taken care of you. And then he's just a smile on his face, you know, it's so satisfying. So to see a patient fight so much for their life, and to know that we've been there in that critical point in their life, and to actually see them alive walking out of the hospital, that's the most satisfying thing.